For some 46 million people, or 14% of all Americans who live in rural communities across the U.S., their area hospital is an indispensable lifeline, often the only provider of medical care within a reasonable drive. But over the past few years, an increasing number of rural hospitals have been forced to shut their doors for good, leaving their patients and communities with few options. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle with AHA Communications. In September, the AHA released a new report highlighting the variety of causes that resulted in 136 rural hospital closures from 2010 to 2021, and a record 19 closures in 2020 alone. Many factors drive this alarming trend. They include long-standing pressures such as low reimbursement rates, staffing shortages, low patient volume, and regulatory barriers, as well as the continued financial challenges associated with the COVID-19 pandemic. More recently, expenses for labor, drugs, supplies, and equipment have skyrocketed, causing difficulties in maintaining access to care for people in rural communities. Today, we're pleased to hear from a health system leader who is dealing with the unique pressures facing rural healthcare providers every day. Welcome, Jeff, and thanks so much for taking the time to speak with us today. Before we get into questions, just let me ask you to provide me with a little background on Wayne Healthcare and some of the services that you provide to your community.
I'm Jeff Subler. I'm the president and CEO of Wayne Healthcare in Greenville, Ohio. We're located in west central Ohio along the Indiana border. And we are in a city of just under 13,000 people in a county of almost a little over 50,000 people. Most of our population is elderly. It's a very rural, agricultural county. We are the ninth largest area in the state of Ohio as far as land mass. And we're the only acute care general hospital in the county. So we serve the entire population of our county. Heavily Medicare dependent with that population. We have about 75 staff beds, but we are full service. We have obstetrics, ER, inpatient unit, and senior behavioral health unit as well. Our local hospice organization has some inpatient beds in our facility.
So, Jeff, you really seem to offer a wide variety of services to your rural patients, but it can't be easy. What are some of the unique challenges facing rural communities and rural hospitals like yours?
Like a lot of people, workforce is huge at the moment. It was a struggle before the pandemic and an extreme struggle now. What happens in a rural area, we don't have a large pool of people to pull from. We reside in a small city in a county with not a lot of people, but a lot of area to cover, and getting qualified staff to our facility is very, very difficult, and to provide and continue to provide all the services that we want to provide and have been providing for many, many years. From the healthcare side, we always struggle with access to specialists. We try to do as much telehealth as possible, but being the only hospital in the county, we want to provide as much service for our folks here. They don't have to travel to an urban center. So access to specialists is critical and key for helping keep our population healthy, but keep them local as well. The other is transportation. It kind of ties into our folks' ability, the community's ability to travel to see specialists or travel to see the next level of care. From our standpoint, transportation of our patients to and from nursing homes or that next level of care is very difficult here. There aren't very many transport services. The ones that are around are very, very busy. Leads to long wait times and frustrations by our providers.
That's something we hear again and again, the transportation problems that come with being a rural care provider. And I can only imagine that the closure of rural hospitals makes the problem that much worse. What can you tell us about what your patients and communities have experienced in terms of dealing with the closure of rural hospitals?
If a facility like ours, especially the rural areas, the nonprofits that are providing this whole range of services, leaves or cannot provide that service, community members get less healthy. I'll liken it to a food desert when you hear so much about certain areas of the country, certain areas of many states, when grocery stores, the smaller grocery stores leave, and the community members don't have access to fresh food, fresh fruit, those types of things. The same concept applies for healthcare. If it's not available, you've got a healthcare desert, and they have to travel long distances to get care. And we know human nature, unless it's urgent, they may not. So your population becomes less healthy. And these rural areas, there's not a lot of choices. So when we struggle, when we close, you mentioned that so many of across the country have closed, and that pace has accelerated the last few years. And COVID certainly exacerbated the strain on these rural health systems, including ours. It certainly leads to less quality of care and worse outcomes for the population.
Yeah, and as if you didn't already have enough to deal with, I know that the financial challenges facing the entire field has been severe this year for a wide variety of reasons, many of which AHA has really talked about in our own communications. Can you tell me, Jeff, what financial challenges has Wayne Healthcare faced specifically in this past year, and how has it affected your ability to treat patients?
Right now, wages are just off the charts. We're trying to compete again, trying to draw people to our facility, high quality people, and to keep the people that we have. The wages have just increased exponentially. So we're trying to manage that. The travel staff, the agency staff issue, we've had to partake in agency staff to fill these positions and vacancies. And we know during COVID, those prices doubled, if not tripled, in certain specialties for us, and are slow to come back down. So the wages are just really almost unsustainable. We're competing with larger urban centers that have these large sign-on bonuses and retention bonuses that is a game that we can't play. We don't have the funds to play. It's an increasing strain on our budget and our facility for wages. Our supply costs have never been higher. We are at an all-time high for supplies. So not only are we paying more, there's a lot of things we can't get, or we don't know when we're going to get them. We may place an order for something and just cross our fingers and hope it shows up in the next few months. So supply costs are huge. Drugs, they've certainly outpaced just general supplies, and the projections for 23 and 24 don't look any better. So drug costs are huge. And again, for a small facility, we have a lot of services. We're providing a lot of services. We have a large formulary for drugs, and the inability to get some of those, we've used certain markets, secondary markets, where the prices could be 10 times higher. But we need to get the drugs to have them here to serve our patients. So it's very, very difficult right now. And as you know, inflation in general is high and projected to be even higher the next 2 years. So we're trying to bake those into our budget, and we're already stretched pretty thin.
Yeah, it's clear that things really aren't easy, and I hope our listeners are gaining some understanding of some of the difficulties, financial difficulties that so many of our care providers are facing right now. On the plus side, if there is a plus side, Congress did take note some years ago of the particular circumstances facing many rural providers and supported programs for Medicare-dependent hospitals and low-volume adjustment programs that are designed to help hospitals like yours. Has it? Can you tell me what the impact of those programs has been, and how has it affected your ability to care for your patients and community?
These two programs are very important for us. We benefit from these programs the last number of years. And as I mentioned before, we're a heavily Medicare-dependent hospital. We're well above 70% government pay when you throw in Medicaid as well. But the Medicare, our population is older and getting older throughout the community. In the low volume, being rural, serving a smaller community, volumes are cyclical and very fluid. So we don't have a very steady census at times, and we don't have new markets to go into. There's not an urban center, that we're just not in a market. So we serve the people that are in our area. So both Medicare dependent and low volume adjustment are almost 2% of our net revenue. It's well over $1 million for a small facility like ours. That if goes away, unfortunately makes us have to make choices about service lines.
Well, Jeff, it does look like with the recent passage of the continuing resolution that will keep the government funded through December 16th, that there is, at least for the next 3 months, there still is support for the Medicare-dependent hospital and low-volume adjustment programs that have been such a lifeline. After, of course, mid-December, Congress will have to pass a budget for next year. So looking forward into 2023, what is your message to Congress in terms of extending these vital programs?
It's vital for rural nonprofit hospitals to extend those. Would love to see it made permanent, but any extension would be welcomed. If they don't want more rural hospitals to close, they have to continue these programs and provide more support. Sending our community members to have to drive 40, 50 miles to get basic care doesn't work for the health of this country. And we have to support small hospitals like ours that are faced with tremendous strains right now. I urge them to at least extend this for 5 years and really consider making it permanent.
Jeff, thanks so much for joining us today and hopefully helping people to understand just how much rural healthcare providers mean to the communities they serve and how important it is to preserve them. We at AHA are strong believers in the power of the story to affect the narrative and bring about positive change, and you've certainly shared some powerful stories today. So thanks so much.